Welcome to Influential Entrepreneurs, bringing you interviews with elite business leaders and experts, sharing tips and strategies for elevating your business to the next level. Here's your host, Mike Saunders.
Hello and welcome to this episode of Influential Entrepreneurs. This is Mike Saunders, the Authority Positioning Coach. Today we have with us Josh Millang, who's the president of Retirement Protectors, and we'll be talking about the Medicare Advantage madness. Josh, welcome to the program.
Thanks, man. Great chatting with you.
Hey, so Medicare, we know that's a really easy topic, and I think you kind of put the, icing on the cake by saying madness, because I think a lot of people get confused about Medicare and it changes. So bring us up to speed. What is Medicare Advantage madness?
Yeah, thanks, buddy. What I'd like to just kind of start with is just laying the foundation a little bit. We're going to talk specifically about Medicare Advantage. There are several different parts of Medicare. Medicare Part A is for hospital. Medicare Part B is for medical. Medicare Part D is for drug plans, and Medicare Part C actually is the Medicare Advantage program. It's been getting a ton of press the last few years. It's been growing in popularity. It's incredible. The last couple of years, everybody suddenly has an opinion on whether it's a good or a bad program. So I want to just kind of dispel some of the myths and the madness of this particular program.
Yeah, I think that's a huge piece, because I think people, myself included, lump Medicare into everything you just said and think that's one thing, but there's different elements and aspects.
Yeah, definitely. And it's depending upon somebody's situation, one of those different parts of Medicare may be the thing that they need. Just with a lot of press lately, it's really given people an opportunity to have a lot of opinions, and people are asking, if this is a good thing or not, from their neighbor and their mechanic and their plumber and everybody in between, and they're getting a lot of bad information from a lot of people who have no idea about these plans, and I'm just kind of want to educate people on sort of where they fit and where they don't fit.
Yeah. So you work in financial services. There's a lot of financial services you can work on with your clients. What was it about Medicare that made you gravitate toward that to help people understand and get it clarified in their mind?
That's a great question, Mike. So really in our practice, we're a third in terms of our business, and we have been for really forever. A third of what we do is health, and that's really focused on our core client is approaching or recently retired. And then the other part is wealth and legacy. So that's really the work we do is kind of in all three of those. And oftentimes it starts with Medicare, because it's a lot easier to get referred to somebody about Medicare than it is about, moving your entire retirement savings to some person. So it's a lot more referable. So we get a lot more from an activity standpoint. And also it's one of those things where if you can really prove your mettle, in terms of how your process works and how you take care of your valuable clients, with something super important like people's health insurance, it really does open the doors to, gosh, I have somebody who does this stuff in wealth or in legacy, but they don't have a program like you've got.
You've earned their trust at that point.
Yeah, exactly. So oftentimes that's kind of the point of entry, Mike, into the relationship, and it's super important. And there's just so much information out there; it's super confusing. So that's kind of like why that's a piece of our sort of three-legged stool, if you will.
And I know enough about you and your practice to know that you give and serve and educate and teach. And when you can give, serve, educate, and teach in a area like Medicare that has so many moving parts and pieces and volatility and changes and updates, and who in the world can stay up to date on that as a consumer? So they need to rely on someone that can go, okay, let me learn your situation. What do you need? Here's the path forward.
Exactly. Yeah, exactly right. I mean, the amount of the licensing, certification, and experience it takes to actually be good and stay relevant in this space is crazy. I mean, it's as much as I have to do on the security side, on the advisory side, the fiduciary stuff with investments. It's really wild.
So what makes Medicare so confusing? Why is there so many? Why isn't it just like, if you want it, check the box, yes. If you don't, here, what makes it so confusing?
Yeah, I mean, it really boils down to people's individual situation. And that's the thing. There's just like in anything, you've got blanket recommendations out there, buy term and invest the difference, don't have any debt, don't buy lattes, whatever,
Yeah.
whatever the thing might be. You've got people out there that are just kind of shucking these broad generalizations about, this particular Medicare plan or that particular Medicare plan. And though they may be correct, they're not correct in all instances. And so people kind of can gravitate towards the one that their neighbor, you got that little echo chamber going on. So if all your friends think this particular plan is good, you're going to think that plan is good.
Yep.
So it just can be confusing because of what's going on out there. You open up a newspaper, you're going to see a bunch of stuff on Medicare. You're going to look at it and see it on TV and on the internet and in the mail and everywhere else. So there's just an abundance of information. Let me put it this way. There's an abundance of information, but an extreme lack of education, if that makes any sense.
Cohesive education. So I think it's like really great that we have this big old thing called Google, but when you have an abundance or an overabundance of information, all of a sudden you start shutting down going, where do I turn? Well, I don't know the path forward and I'm confused. So it's that cohesive putting the pieces together for your personal situation. And maybe, couple A is different than couple B, and maybe there's a different way to approach it. So it kind of goes back to, you really can't just go check the box, Google it and go, good, I've got my Medicare, because it needs to apply to your specific situation.
Yeah. And you're going to find, whether you're asking Google or asking someone else, you're going to find the opinion that you're seeking.
Yeah. But is it the right one? Yeah.
That's the thing. I mean, you're going to find what it is that you're looking for, but it doesn't have all the information. It doesn't have the licenses, certifications, experience of dealing with these things over a decade with thousands of people. It doesn't have, it doesn't have the actual knowledge of your situation. It has information, not an education. So, that's kind of become the thing with a lot of people. And unfortunately for them, honestly, they have sort of started to seek and find some of the negative stuff on these plans, which is super unfortunate because they can be really a blessing for a lot of people.
That is an interesting point. Is you go to, let's say, online and search this restaurant you want to go to, and it's like, look at all these great reviews. Oh yeah, we want to go. And you see this one negative review. It's like, oh, I'm not going. Well, don't throw the baby out with the bathwater.
Right.
So you heard this one little negative thing about whatever Medicare. Well, don't take it to heart, but investigate it, make sure that in your personal situation, how would it affect me, and evaluate it and assess it, but don't just disregard it. So that's a really big point that you bring up there in any situation, but especially with Medicare.
It's super important. Yeah. And kind of one of the things that we were, kind of planning on discussing is just sort of the background that my firm and I have had in this space, because I think it's important. Just in terms of how I've gotten to this point, and we've gotten to this point with our practice, just to add a little color to that. I mean, when I got into this business, I worked for an insurance company, Mike, that did not sell Advantage plans. And so therefore they were big fans of Medicare supplements and not Advantage plans. So, I kind of got to learn why they were terrible. I didn't get to learn, why they may be good in certain situations. So I kind of came into, when I started my business, this, hey, Advantage plans are bad, because that was really how I was trained. I think one of the things that people need to consider is who you're getting information from too. If you're getting information from people who only work with one plan type versus the other, you're going to get a very biased situation. And if they only work with one company in each plan type, if they even work in multiple plan types, you're going to get, really limited information. And so the only thing that's important that you do is work with somebody who not only works with, the, original Medicare A and B with the supplement and drug plans, but also that has access to Advantage plans and is licensed, certified, and experienced in those as well, because then you're going to really get somebody who's got the perspective of both plan types, but also it's critical that they're working with multiple companies inside each plan type, because depending upon where you live, there are certain carriers on the MedSup and the Advantage plan side that are really going all in your particular area at any point in time. So it's really important to work with an independent health advisor on this stuff that has licenses on both and also is working with multiple companies. So that's
because it gives flexibility of what you can offer your client, because it reminded me when you were explaining that of like, if you're a hammer, then everything you look at is a nail, and it's like,
Exactly.
if all you can offer is this or that,
Right.
then that's all you're going to offer. And if you're a captured agent, then all we're selling is this. And I love that you used to work for the dark side or the other side, and you came into it going, ooh, this is bad because, and then slowly but surely, maybe you're like, you know what, maybe there's some good in this, and maybe there's some caution here. And so I like when you can look at this from a perspective of what's going to benefit the client best. And let me, since there's many, many options, let me make sure I've got some outlets, carriers, and plans that will fit this need, that need, the other need, because you don't just have one that you offer to everybody.
I've got to tell you a story, and then kind of that sort of dovetails into some of the rest of the history that kind of got us to where we're at with this. But I had a business broker reach out to me based on the licenses I had and so on. It was a town a couple hours away. And they're like, hey, there's this person that has a practice, got a couple hundred clients, and she's wanting to sell it. She's got some health complications and she's trying to retire. And I was like, yeah, I'll talk to you. And I go and meet with these people. And the valuation was fair. I kind of looked at the inner workings of the business, and this lady had 200 clients, Mike. Half of them had supplements, half of them had advantage plans. And I was like, this is amazing. I'm going to take these supplement clients and take really good care of them. And then I'm going to go help these idiots that have these advantage plans. I'm going to go and help them and save them and get them onto a supplement. I'm going to make so much money helping these people. It's going to be amazing. You don't know what happened.
The opposite.
Obviously I went and talked to these people, and they were like, hey brother, just so you know, we understand that you bought this lady's business, but if you're here to try to switch us off our advantage plan, you can go ahead and get back in your car. I was like, no. You understand, what you have is terrible. And then client after client after client educated me on why these plans were phenomenal for them. And I was like, wow. I mean, this was a 6-month process. And so we then, because of that, added that into our product lineup at our company. And so we started on new clients that we had and existing clients we had, working that product in as an option. And then I actually, we expanded it into multiple other carriers, and we really experienced some growth. And then now I'm making some additional acquisitions, and about half the clients are supplements, about half of them are advantage plans. That's about the composition of our practice, in general. And it's been really, really eye-opening.
So let me recount back what you said here and kind of tip of the hat to you and your character. You went into that with a preconceived bias of one way, but yet you personally did not dig your heels in and have the pride of, I know best and I'm going to fit the square peg in the round hole. You went in and you listened and you learned, and oh my goodness, you now then adjusted and pivoted. You didn't flip the other way and now you just added, and you went and learned and educated yourself. And now your practice is better for all of your clients that you're working with. And I think that is such a spectacular thing for someone to listen to go, you know what? Here's Josh, who's got a lot of experience. And now every single time that he's coming up against something, it's not the bull in the china closet, let's get through it. It's, okay, let's see if there's some value here. What can I learn from this? It's not I win or lose, I win or learn. And I think that is just a really great testament to how you treat your clients.
Yeah, man. Thank you. And I'll tell you, it was, I might've been a bull in a china shop a little bit, at the beginning. And then I was like, but you
totally redeemed yourself.
Yeah. What, right. Are you sure about this? Like, tell me exactly how this is working for you. Cause I know how these things work, and it can't do that. So, what's interesting is over the course of, that was probably 12 years ago that I bought that practice. And then it's kind of grown from there. And, obviously the rest of the business, but, at this point, they release figures on a monthly basis of the percentage of Medicare enrollees, which, by the way, there are 60 million people on Medicare as of right now. Wow. Of the 60 million Medicare beneficiaries, Mike, 46% of them have advantage plans as of July of this year.
Okay. That says a lot.
It says a ton. And I don't know that's going to make it through this year without that tipping over to 51%. So, what's happened is these companies have continued to enhance their offering, get additional funding from Medicare, made the plans more attractive. More people sign up as a result. They get more funding as a result. It's just a snowball. And although these plans had been met with a lot of skepticism initially, and rightfully so, the options and the networks and all these things have improved so dramatically over the last, since they've been out in 2004. Over the last 18 years, they're almost unrecognizable.
So what are people like today hearing Medicare Advantage? What are they afraid of and concerned about that once they understand, what your research has shown, that they at least consider it?
That's a really good question. So I'll tell you just kind of like the four that we run into a lot. The first one is, I can't see my doctor. That's
Okay.
kind of one of the original,
Yeah. I've had for
and by the
20
way,
years, and they're my best friend now. Yeah.
a lot of these concerns are from people and companies that don't sell these things. So they're creating these narratives to have people, start questioning their decision making and stuff. So, which is kind of gross, but so the I can't see my doctor thing was actually a thing, because in a lot of communities, when these plans first come out, they come out with what's called a PFFS, or private fee for service plan. And in those cases, your doctor can actually decide whether they want to take the plan or not. If they do, they have to adhere to the terms of the plan, but they don't have to. And so the first Advantage plans that a lot of these people got exposure to were plans that literally their doctor might not take, or their hospital might not take. So that kind of started the spinning the wheel of bad press, if you will, for them and maybe even their community and some stuff on a national basis. So, but now, like, they are phenomenal in terms of the networks and coverage and stuff like that. There's HMO plans. There's HMO plans with point of service benefits, where you can see anybody who's a licensed and contracted provider with that particular insurance carrier. They have PPO networks. They continue to get better and better because, surprise, Mike, if you've got 1,000 patients coming into your clinic and 4 of them come in with this different plan, and you go, yeah, I'm not going to take that.
Yeah.
Well, now your 1,000 clients, you got 50 of them coming in saying, hey, are you in the network of this plan? You go, actually, I love that plan.
Yeah,
I'm
right.
glad that you have it. Come on in. So the networks are just organically expanding and being strengthened by the fact that half of the
demand.
People, right. And this is honestly one of those things where it is really one of the few things that I've ever witnessed in my career that is really a consumer driven shift in anything. There's been a lot of shifts in a lot of things, but they're generally not consumer driven, and they're generally not for the benefit of the consumer.
Yeah.
The transition to Medicare Advantage has been really unbelievable to watch. And it's really a consumer driven situation that is very much for their benefit. And it's kind of a self-fulfilling situation. It's been really interesting. So I can't see my doctors is the one thing to kind of summarize. And that's just not the case anymore. There's not, if you couldn't see your doctor on these plans, 30 million people in America wouldn't have them.
Yep. And so now
someone would have found out.
That might have been a concern back in the day, but now that's probably not the big concern. What's another one of the concerns that is typically thought, but now you need to rethink it?
People hear, like, I can't get the care I need. What it's literally every time. What if I have X? What if I need Y? These plans are Medicare Part C. So how they work is they actually take the place of Medicare Part A, B, and D. They administer all those Medicare benefits for you from a private company. And this is going to come as a shock to a lot of people who are listening. But as it turns out, very large private insurance companies can be stewards of your Medicare money better than the government.
Yeah.
I don't know if there's any.
I don't think there's anybody that could be shocked at that.
But what's shocking is how much better they actually can do with that money. It's insane. So these carriers get a Medicare reimbursement on a monthly basis for every member they have in their plans. And that amount is based on how much it costs Medicare to administer these benefits for people on a monthly basis. So it's a push for Medicare, where they basically say, look, Mike, your company, for every member you get, we're going to get X amount per month. If you make a profit off that, terrific. If you don't, tough.
Yep.
And these companies are like,
okay,
well, how much are you going to give us?
Yeah.
Well,
I can work with that. Yeah.
Our only job is to build a plan that's as good or better than original Medicare. What's the catch here? You know, they're like, we can do that with our hands tied behind our backs. And they do, and they have. And that's why this thing has evolved into what it's become. It's really awesome. So the plans are required to have coverage. They cover everything that Medicare A and B and D covers. They're required by law to. The difference is you have one plan administering all those benefits, and they can charge differently for those services, different than original Medicare may. So if you have coverage for some particular procedure with original Medicare, these plans have to cover that as well. You can't just, one of them can't say, well, we don't want to do that.
Right.
They have to cover it. It's just a matter of how they charge it, your cost share, whether it's a copay or a coinsurance or whatever. So it's the I can't get the care I need is just not even a thing. I mean, it's just not even, it's literally not a thing.
So I can't see my doctor, can't get the care I need. And you said there's 4 top ones that are myths.
Yeah.
What's number 3?
The other one, the costs are higher. You know, people are like, oh my gosh, you know, it's going to be so much more money. You know, and what we do is just take a look at the math, man. When we take the emotion out of it, the emotion of people going, oh, these are scary, I've heard bad things or whatever. I got a crazy ad that I saw on my Facebook page that said that these things are the devil, you know.
Right.
You know,
Bob at the barbershop told me.
Yeah, well, when you take this emotion out of it and you apply some logic and reason and you literally look at the math, you go, okay, well, if I'm paying X for my supplement and I'm paying Y for my drug plan, including the premium and deductible and copays, then Z is my amount that I'm going to pay, you know? And then, you know, kind of when you look at these, what we generally find like 80 or 90% of the time, Mike, is that by the time we add up, hey, you definitely have some out of pocket costs, but you don't have a premium. So it's the difference. It's like the total opposite. So rather than having a premium and a deductible and no copays, these plans have no premium and no deductible in most states, but they have copays. It's like the actual inverse. Yeah. And so the math problem is, what do you got going on? You know, let's see what based on what you got going on, let's take a look and see what the copays would be for those particular things, because your health is pretty close to what your health, you know, has been and will be. And so we just look at it. And by the time we add up, you know, 25 for this and a couple hundred for that and a few hundred for that over the course of the last several years of their life, it's very regularly a better deal for them.
The same, if not better, but definitely not worse in most cases.
Oh my gosh. Very, very rarely.
I like that you take that emotion out, or you take that preconceived notion out, and you look at the numbers and it's like, oh, okay, we're good.
Yeah. Oh, right. And that's how it goes every time. They're like, well, that's logical. Okay. Well, and then on top of that, because these plans are so exceptional at being stewards of the Medicare money that you've paid into the government your entire working life, they have all this other stuff like dental and vision and hearing, and they cover some over-the-counter stuff. They'll generally cover like a gym membership. I've seen massage therapy and acupuncture and a $500 budget for a service dog.
I want that. I want that plan.
I'm telling you, it's a St. Louis plan. I'm not even joking. So because they do such a great job with that Medicare reimbursement, they're able to add all this stuff on a lot of these plans, Mike, that original Medicare doesn't have anything for those things. So it's not only a as good or better type of situation for your core A, B, and D benefits, but on top of that, there's generally these other things that you're either paying for out of pocket, you're paying insurance for, or you just don't have. Yeah. So it's a pretty great value proposition overall for a lot of people.
Excellent. And was there another kind of a misconception you wanted to touch?
Well, this is a quick one. We covered it a little bit. You know, I'll be off my Medicare. Well, that's just not true. I mean, Medicare Part C is the Advantage plan. Medicare Part C's job is to administer your Parts A and B and D in one plan through a private insurance company. So yes, you're off original Medicare A and B because it's being managed by someone else. Yep. Medicare, this is a thing of Medicare. It's in the back of your Medicare and U book every year. It's on Medicare.gov. It's these are private insurance companies administering your benefits.
It's Medicare elevated.
That's a really great way to put it, man. I think Medicare Advantage 2.0 might be
there you go. Well, if someone is thinking, wow, I've been Googling around and it is so confusing, stop the madness, what's the best way that they could reach out and connect with you so that you can help them to get clear on what some of the advantages are for them?
Let me answer that first by saying definitely what not to do.
Yeah.
Okay.
Mhm.
What definitely not to do is go around and ask people if these are bad. It's like
Yeah.
going to the internet and saying, "Are the New York Jets terrible?"
You'll
You're going to get
you'll find that answer. Yeah.
you find that
Yeah.
answer. Don't ask that. That's what you're going to get. So you need to find someone who's an educated, experienced, licensed, certified health advisor in this stuff that works in both plan types with multiple companies. But definitely don't ask your plumber or the grocery store clerk, because they will have an opinion and it may or may not be correct.
Yeah.
But it might not be the right opinion for you.
Yes.
And we see so often that it's, hey, I asked my daughter's niece's neighbor's babysitter is a billing clerk at the local clinic.
Yeah.
And she just says these are terrible.
Yeah. Right. Right.
Oh, okay. Well, there it is. You've got your answer.
So let's not do that. What should they do?
I mean, oh my gosh. So they should, connect with someone who's got that experience and credibility. And frankly, we as a firm have been working with these plans for over a decade. We have thousands of clients that we manage on them, and we've managed thousands more. And we've seen people who are in good health, bad health, average health, everything in between. And we know these things inside and out from a service standpoint. That's the biggest thing too, is aligning with a firm that can provide the service on the back end, because there may be some bumps along the way from that standpoint. So that's an important thing. But we're different not only because of that, but also, Mike, because we don't care what people have. Like, look, because we work in both types of plans with multiple companies, we don't really give a rip what you got, as long as you got it with us. So
Yep.
if you want to have a supplement and you're most confident with that, we want you to have that. If you think this could be a better deal, let's educate you on it and let you know if it's a good option, and we'll sell and service it for you. That's what we get paid for. So we don't care what you have. So we can take really a unbiased and unemotional look at this on a regular basis, on an annual basis, and say, you know what, this is a better deal for you, and here's why. And so, but if it's not, look, if you're in a good spot, I'm going to tell you. If you're not, I'm going to tell you. It's
Awesome.
really that simple. So
That sounds great.
That's the long and the short of it.
And then what's the website that they can reach out and connect with you for?
Yeah. So just retireprotected.com. So like, we want you to retireprotected.com. We have some information on Medicare, but at the end of the day, reach out there. We have 515-992-5000 is another number that goes directly to us. Just reach out. And like I said, if you're in a good spot, we'll let you know. And if not, we'll let you know. But it's definitely worth engaging with a qualified professional with a ton of experience to help lead you down the right road or not.
Exactly. Well, Josh, thanks so much for coming on. It was a real pleasure talking with you and learning how you serve your clients.
Thanks, man.
You've been listening to Influential Entrepreneurs with Mike Saunders. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.influentialentrepreneurssradio.com.